స్టాప్ అదే కదా,
స్టాప్
అంతే కదా, అది కొట్టేసి వచ్చేస్తా. ఓకే,
ఆల్రెడీ స్టార్ట్ చేయనా సార్?
చేసి ఇట్లా వస్తుంది కదా.
ఓకే సార్, వస్తాం.
స్టార్ట్ అయిందా?
స్టార్ట్
అయిందా?
అయింది సార్.
ఓకే. Good afternoon. Today we will discuss something about asphyxiants. Asphyxiants are the agents or substances which cause harmful effect or ill effect on the human beings. The asphyxiants are discussed under various headings, or they are classified into various classes. Irritants. The irritants, the gases injure the air passages. They cause irritation, inflammation of air passages starting from the external air orifice from the nose up to the lungs, and they cause inflammation and injury to the air passages. The examples in this category are like smoke, tear gases, ammonia, formaldehyde, chlorine, phosgene, nitrogen dioxide and sulfur dioxide. This causes irritation, inflammation and damage to the airway. Number 2 is the chemical asphyxiants. In this category, these are the gases which, by combining with the hemoglobin or by acting on some tissues in the body, and that prevents the oxygenation or utilization of the oxygen by the tissues. This is because of a chemical action on the human body. The examples are like carbon monoxide, hydrogen sulfide, arsen, carbon disulfide and cyanide. These are some of the examples which causes asphyxia by chemical means. They are categorized as chemical asphyxiants. The third category, we call them as a simple asphyxiants. Simple because they are inert gases, and when they are taken in or when they are breathed in high concentrations, they act mechanically and they prevent the absorption of the oxygen by mechanical methods like carbon dioxide, methane, helium, nitrogen and nitrous oxide. And normally the symptoms appear when these gases or the concentration of these gases exceeds more than 20 to 30% in the inspired air. When in the inspired air the oxygen concentration is less than 10%, even the mild exertion or the slight exertion may lead to death of an individual. And fourth is volatile drugs. In this category, these are the gases with little or no irritant effect upon the air passages, and they act after absorption into the blood either as an anesthetic or as agent toxic to the liver, kidney or other vital organs, including the nervous system. So in this category, we know that they are aliphatic hydrocarbons, halogenated hydrocarbons and aromatic hydrocarbons. These things, they come under volatile drugs. And fifth category is systemic poisons, which are like insecticides, arsen, stibin. This in toxicology, we are also talking about the insecticides, how they the cause of death by asphyxia. So all these things are asphyxiants which come under the category of systemic poisons. Now coming to the carbon monoxide, this is it is a colorless, tasteless and non-irritating gas, and that is normally produced due to incomplete combustion of the carbon. And this carbon monoxide is not soluble in water, and normally it burns with the blue flame. And another characteristic of carbon monoxide is it is lighter than the air. That's why they reach the higher level in the atmosphere. It's lighter than the air. In a closed environment, greater concentration is present at 1.5 or 2 meters above the ground level. This carbon monoxide seeps through openings around the doors or the large cracks in the walls. Because it is lighter than the air, it is naturally understood that it seeps through the openings and tries to remain at a meter of 1.5 to 2 meters at higher level than the ground. Of course, it may also leak through the ceiling cracks or any other, like even the low roofs and all these things. When there are openings or the vents in that, it will seep through that to the higher level. A mixture of a carbon monoxide with 2.5 times of its volume of air, and it is highly explosive. See, the common source of carbon monoxide, it includes in coal gas, smoke from the fires, and fumes from defective heating of appliances, like defective heating in furnaces, stoves, water heaters and fireplaces, or even the burning of oil lamps. Normally a yellow flame generates carbon monoxide, while a blue flame burns it completely with no byproducts. It is also found as a component of fumes of coke kilns or lime kilns, explosion in the mines, or in the choke damp improperly ventilated collieries at the dead ends, detonation of explosives, and in the exhaust fumes of internal combustion engines. And normally the industry accounts for about 20% of carbon monoxide. And another common thing which you should know is a person who smokes. If a person is smoking 1 pack of cigarettes per day, the carbon monoxide levels are about 5 to 6%, and in a heavy smoker it will be even up to 15 to 20%. Similarly, the traffic policemen who are exposed to the lot of fumes and gases, pollution, they have got carbon monoxide level up to 10% of the saturation. The exhaust gas of the motor cars, they contain 1 to 7% of the carbon monoxide, and this causes air of a small garage. So when these cars are in a garage, and if they emit this gas, that causes poison atmosphere in the garage within 5 to 10 minutes. And another information what you should know, the diesel engines, they produce less carbon monoxide than the petrol engines. So normally we think that petrol, because it emits less fume and less smoke through the silencers, we normally think that petrol is less poisonous, but the diesel engines, they produce a lot less of the carbon monoxide than the petrol engines. And during hemoglobin catabolism, 0.4 to 0.7% of carboxyhemoglobin is produced in the body endogenously only. And in hemolytic anemias, carboxyhemoglobin levels may reach up to 8% in the body. And another finding normally seen is in the females, carbon monoxide is twice as great during the progesterone phase of menstrual cycle as during the estrogen phase. So the carbon monoxide level is almost double during the progesterone phase of menstrual period when you compare to the estrogen phase of menstruation. What are the actions of carbon monoxide? Its pathophysiology or chemical action, or its carbon monoxide, it is readily absorbed across the alveolus and it combines with the hemoglobin. Normally the blood contains 21% of oxygen, and out of that 18 to 90% is bound to hemoglobin and 2% bound in dissolved in plasma. And about 10 to 21% of carbon monoxide is present in the extracellular tissues combined with myoglobin and hemoproteins. And another interesting chemical finding is carbon monoxide affinity to myoglobin is about 40 times greater than the affinity of oxygen to myoglobin. That may cause direct myocardial depression. And carbon monoxide also has got 200 to 300 times greater affinity for hemoglobin than that of oxygen. So if at a given time carbon monoxide or oxygen come in contact with the hemoglobin, the affinity of carbon monoxide to the hemoglobin when compared to that of oxygen is 200 to 300 times greater. That's why it displaces the oxygen from the hemoglobin and it forms a carboxyhemoglobin. That is how it reduces the oxygen content of the blood, and definitely because there is less oxygen for the tissues. And it acts as a chemical asphyxiant, and because of its affinity for the hemoglobin, and it causes anemic anoxia, and normally the death will be due to anemic anoxia only. And carbon monoxide by itself is a potent cellular toxin, and it effectively and very firmly binds to the hemoglobin and myoglobin, I told you, and it inhibits the electron transport by blocking the cytochrome A oxidase and cytochrome P450, and therefore it affects on the intracellular respiration. It also interferes with other ferroproteins such as myoglobin and various other enzymes. And the presence of carboxyhemoglobin in the circulation, it alters the oxygen affinity to the hemoglobin, and by shifting oxyhemoglobin dissociation curve to the left, it decreases the release of oxygen into the tissues. Normally, after somatic death, the cells near the capillaries continue to function and extract oxygen from oxyhemoglobin, and that causes blue staining. And in the carbon monoxide poisoning, this cannot occur because the cells cannot break carboxyhemoglobin compound. So potent cellular poisons, that is cyanide or fluoroacetate and freezing, they block the metabolism of the cells, so fast and completely that they cannot extract oxygen from the oxyhemoglobin. That's the reason why in these cases the blood under the skin and the tissues will be cherry red due to oxyhemoglobin, and also the platelet aggregation also is inhibited. What are all the signs and symptoms in the carbon monoxide poisoning? The brain and the heart, they extract the greatest percentage of oxygen, that is from 6.1% in the brain and 11% volume percent in the heart. So these organs, that is the brain and the heart, they are the earliest and the most greatly affected when there is a reduction of oxygen or when the oxygen delivery is reduced. So the symptoms developed due to this, they are often mistaken for the symptoms of influenza, or sometimes even it is mistaken for food poisoning or eating. The symptoms developed due to contaminated food intake. So the development of the symptoms, they have continually progressed and they are parallel to the rise of saturation of the blood by carbon monoxide. So as the concentration of the carbon monoxide levels increase in the blood, the symptomatology also varies. So the various levels of the symptoms have been described. See, when it is less than 10%, there is no appreciable symptoms, and from 10 to 20%, the breathlessness on moderate exertion, mild headache and weakness will be there. And when the concentration reaches up to 20 to 30%, there may be severe throbbing headache, irritability will be there, emotional instability, because I told you the organs affected chiefly are brain and the heart. The CNS symptoms are more prevalent or appreciable, like throbbing headache, irritability, emotional instability, disturbance in the judgment and defective memory, and easy fatigability or early fatigability. And as the carbon monoxide level increases in the blood, if it reaches to 30 to 40%, there will be very severe headache, there may be nausea, vomiting, dizziness, there may be defective or dimness in the vision, and there may be confusion states, because as the carbon monoxide levels, they go up to 50 to 60%, patient may go into the syncope or into the coma also. There can be intermittent seizures, tachypnea or increased respirations, there can be tachycardia, pulse will be very weak, and of course there will be pink or red color discoloration of the skin. When the carbon monoxide level goes up to 60 to 70%, the level of coma or the depth of the coma will be increasing, and he may develop symptoms like incontinence of urine or incontinence of feces. And when the levels are between 70 to 80%, there will be profound coma, and there will be absent or very low deep reflexes, very weak and thready pulse, shallow respiration, irregular respiration, and it may result into the death. Anything more than 80, there will be rapid death, and death is due to respiratory arrest. So when the patient is about to, and the stages like 70 to 80 concentration or even some 60 to 70%, there is a tendency that the dying victim, he may become wild, erratic, there may be irregular swinging movements in the room. So he may disturb the clothing because he has become irritable, emotional judgment is lost. So the disturbing in clothing and even furniture he may throw here and there. And whenever somebody visits that room, there is a possibility that they may come to the conclusion that there was some violent struggle. And this is sometimes known as carbon monoxide automatism. I told you that death usually occurs when 80% of the hemoglobin is saturated with carbon monoxide. Elderly age, that is senility or any disease or any comorbid conditions or any respiratory deficiency, or if there is association of like things like anemia, or if the patient was on any hypnotic drugs, or if he is under the influence of alcohol, there will be a significant reduction of the maximum lethal saturation. So even at the lesser concentrations, the person can die with the other comorbid conditions which we discussed just now. Carbon monoxide can pass from the maternal blood to the fetal blood, and carboxyhemoglobin concentrations are 10 to 15% higher in the fetal blood than in the maternal blood. So this may lead to IUD or intrauterine death even though the mother survives, because the concentrations level will be more in the fetal blood when compared to the maternal blood. And higher rate of respiration. If a person breathes more number of times, or if there is a, excessive respiration, it is understood that the carbon monoxide poisoning ratio also will increase. Children, they saturate their blood more rapidly than adults because relatively their respiration rate and respiratory exchange is more than the adults. If the patients who are recovering from carbon monoxide poisoning, they may suffer from neurological sequelae like tremors, there can be personality changes, the patient may develop psychosis, peripheral neuropathy, there can be visual loss or defective visions, or there may be lack of concentration, their inability to concentrate on the things, and even they may develop conditions like Parkinsonism. And this sequelae of carbon monoxide can be temporary, or they may be a permanent sequelae of the poisoning. Sometimes the complete recovery after serious poisoning may take many weeks, and even sometimes the people will become second time the symptomatic after 3 to 4 weeks after recovery. Also again they may become symptomatic. In chronic carbon monoxide poisoning, the symptoms will include mostly neurological symptoms like headache, confusion, weakness, paresthesias. I told you the visual disturbances, hypertension, there can be hyperthermia, palpitations because of cardiac effect, fibrillations, atrial fibrillations, or there can be a bundle branch block. So AV blocks are seen, and there may be abnormalities in the left ventricular function of the heart. There may be decrease in the cognitive ability, there can be a mental retardation, there may be psychosis, and of course there can be again symptoms of Parkinsonism and even incontinence symptoms. The delayed death in carbon monoxide poisoning, it is accompanied by degenerative changes in the brain and capillaries, and the individuals who survive for longer period, they will have the Parkinsonian syndrome, and they also develop many neurological conditions. See, the different air concentrations of carbon monoxide depends on the humidity, the high environmental temperature, the physical activity. If there is increased respiratory rate, the absorption of the carbon monoxide also will be increased. I was just telling that. The upper limit of safety is 0.01% of carbon monoxide in the air. That is the safety limit of carbon monoxide. If suppose a person breathes carbon monoxide in low concentration for a considerable length of time, and especially during the sleep, then he will be poisoned just as effectively as though he was exposed to high concentration of carbon monoxide for a very shorter period. The symptomatology, the effect on the body when a person is exposed to the longer duration of the carbon monoxide, especially during the sleep, the symptoms or the effect on the body will be like a higher concentration exposure for the shorter time of an individual. So when the low concentration of the gas is inhaled, the coma may not occur immediately, but there will be muscular weakness and there may be complete state of helplessness, and the victim feels or he may not be able to save himself because of the weakness, muscular inability, and when he is exposed for the higher concentration even for the smaller period. How do you treat a patient of carbon monoxide poisoning? Remove the patient from the source of exposure, remove him to the fresh air immediately. That is the first thing one should do it. If the individual or the patient is conscious and if he is having a normal breath, normally active intervention may not be required because he is exposed for the normal fresh air, and with a normal breath usually they recover. If a patient with carboxyhemoglobin level greater than 25%, then he should be treated. And the most widely accepted treatment is 100% of oxygen should be provided with very closely tight fitting mask, preferably it should be sealed, or sometimes even endotracheal intubation may be required if the patient is in the state of depression, and this endotracheal intubation will be required until the carboxyhemoglobin falls to 15 to 20% levels. Hyperbaric oxygen, it has got several disadvantages because the patient may develop vomitings, convulsions, he may become agitated, there may be rupture of tympanic membrane, and even there can be blocking of sinuses. And gastric lavage early in the course of treatment, only if there is a vomiting, and otherwise I don't think gastric lavage in carbon monoxide poisoning will have any role. Sometimes there may be necessity or requirement for the whole blood transfusion, and the patient should be kept in complete rest for 48 hours, and try to avoid the stimulant drugs. Though the patient looks drowsy, do not give any stimulants. Of course, you can give any antibiotic as a prophylaxis to prevent any pneumonitis or bronchopneumonia. And cerebral edema should be treated, maybe sometimes with the mannitol or steroids, and there should be fluid restriction. The postmortem appearances: cherry red coloration of the skin and the mucous membrane, and even of the conjunctiva, nail beds, and areas of hypostasis, blood tissues also, and even in the internal organs. They are seen in about 15 to 20% of the cases, and it is usually seen when the carboxyhemoglobin levels are around 30 to 40%. If the person was anemic, the color may be very faint or even it can be absent. If the individual is dark colored skin, so the coloration may be masked, and of course sometimes you can see it in the inner side of the lips or maybe in the nail beds, tongue or palms or soles. The color will not be changed by embalming or even if it is preserved in the formalin. The cherry red discoloration changes to dark green and then to brown when the decomposition starts in the body. The blood is fluid, hyperemia is general, and serous effusions are common. And another finding is there will be many blisters of the skin, like near buttocks, in the calves, wrists or knees. That is normally because of the cutaneous edema. You will see the blisters, and there may be congestion of the lungs with the pink fluid. The blood will be like pink fluid, and if the victim survived for some time, the pulmonary edema and the congestion of the lungs may be seen, and the lungs may show the bronchopneumonic findings, consolidation, and in delayed death there may be focal necrosis seen in the myocardium, and sometimes the frank myocardial infarction may be seen after severe exposure to the carbon monoxide and there was relative hypoxia. And of course, if there was any pre-existing coronary artery diseases, these findings are more likely to be seen. And pleural and pericardial anoxic changes by way of hemorrhages, they are seen very commonly in the pleural and pericardial areas. If a person surviving after severe carbon monoxide exposure and in delayed deaths, there may be bilateral asymmetrical necrosis, and there may be cavitation also in the basal ganglion of the brain, especially in the putamen and globus pallidus, and this is the most characteristic lesion in delayed death or if the patient survives sometime after exposure to carbon monoxide. Hemorrhages in the meninges and in the cortex, cerebral cortex, and there may be selective cellular necrobiosis of the ganglion cells when you examine the brain. What are the circumstances of carbon monoxide poisoning? See, the poisoning or committing of the suicide with the carbon monoxide also is seen, though it is rare in our country, because a person, he may be sitting in the car and close all the doors tightly, and then a tube is connected to the exhaust and the other end is connected into the passenger compartment, that is into the car where the person is sitting in the back seat, and then when car is on, see, this cabin is totally will be filled with the carbon monoxide and the death occurs. And sometimes even the passenger may lie onto the floor just nearer to the exhaust pipe, and then he may inhale the exhausted fumes which is rich in carbon monoxide. So this is also a type of suicide I have seen with the carbon monoxide. And the accidental deaths may be caused by use of fuelless braziers, exposure to exhaust gas of petrol engines, or exposure to the gas in mines following underground fires or underground explosions, or even if there is exposure to gas during the fires. The accidents may occur in connection with incomplete combustion of the wood, charcoal, or coal in ill-ventilated room. And of course, the homicide is uncommon. I cannot say it cannot happen. It can happen if the individual is incapacitated by giving drink, or he was administered some drug and then exposed to carbon monoxide poisoning, or if he was deceased, or if sometimes the victim happens to be the child, there is a possibility of homicide with carbon monoxide. Of course, there are various tests to know the carbon monoxide poisoning, which probably you need not know here. The carbon dioxide. See, the carbon dioxide is a heavy, colorless gas with faintly sweet odor. And normally the atmospheric air contains 0.033% of carbon dioxide. I told you it contains 20% of the oxygen and 70 to 80% of nitrogen. This is the normal composition of the atmospheric air. See, the carbon monoxide was lighter than the air, and carbon dioxide is heavier than the air, and therefore it settles, and when it is accumulates in the absence of air movements, it settles to the bottom. So the common places which may contain carbon dioxide in excess, or in the manholes, ship holds, or even in the old wells, occasionally even in the cellars. So the lower places, because this is heavier than the air, it settles down into the lower places. The carbon dioxide is a non-toxic, but it acts as a simple asphyxiant because it prevents tissues from obtaining oxygen by simple prevention, not as a toxic effect. So the signs and symptoms of carbon dioxide poisoning, they vary with the concentration of the gas. If it is 5% of concentration of carbon dioxide in the air, that is the level which is above the alveolar concentration of the carbon dioxide in the alveolar air. This causes a labored breathing, a difficulty in breathing, and there can be mental confusion, and if it is above 10%, the person may have ataxia and he may even go into the unconsciousness. And if the carbon dioxide levels are up to 40%, there is dyspnea, there will be feeling of very tightness in the chest, there may be fullness in the head, ringing in the ears, and there may be loss of muscular power, and gradually he may become drowsy, unconsciousness and coma, leading to death. And 60 to 80% of the carbon dioxide, it causes immediate unconsciousness. There may be seizures with or without seizures, and the patient may go to or he may die very rapidly due to vasovagal reflex, leading to cardiac arrest. So the carbon dioxide from a well can be collected by using a bottle filled with soda lime water and putting it inside a well. Treatment: artificial respiration and oxygen should be given very freely, and if there is symptoms of the heart, even the cardiac stimulation may be useful depending on the condition. The postmortem appearance: there may be marked cyanosis, congestion of the viscera, there may be suffusion of the eyes and dilated pupils, and of course even you can see the petechial hemorrhages. And most of the times the carbon dioxide poisoning is accidental. I told you where it is seen well, like in the manholes or in the cellars or in the deep wells. If a person enters there, he is likely to be exposed to the carbon dioxide and develop toxic symptoms. And another asphyxiant gas is hydrogen sulfide. And another important something what we should know, important in the sense like now we are hearing about war gases, biological wars and all those things. The term war gases includes any chemical, whether gas, liquid or solid, which is used to produce destruction or damage, mostly in the times of war. See here we have got vesicant or blistering gases. They are mainly sulfur, mustard, phosgene, oximes and arsenic, which are highly volatile liquids. They are discharged in artillery shells so as to saturate the area of attack. No? The mustard gas, it will cause irritation to the eyes, and also it causes irritation to the external respiratory passages like nose, throat. There may be erythema of the skin. There may be blisters, nausea, vomiting and abdominal pain. It passes through the clothes into the skin and it produces very, very intense itching, redness, vesication and ulceration, and especially in the skin folds or where the areas are very moist. And the treatment will be wash the affected area thoroughly with water and wash the eyes with sodium bicarbonate solution, and antidote ball can be given, British antidote. There will be asphyxiants or lung irritants. They are like chlorine and phosgene gases. They are released from the tanks and also from the gas shells. The chloropicrin and diphosgene, they are liquids which are used in gas shells. Phosgene is 10 times and chloropicrin is 4 times more toxic than chlorine. See, the nitrous oxide, the sulfur dioxide, ammonia, these things, they produce chest tightness and also pulmonary edema. The arsine, cyanogen chloride and hydrogen cyanide, they are also used as asphyxiants or lung irritants. When inhaled, they cause watering in the eyes, coughing and dyspnea. There may be tightness in the chest, cyanosis and collapse. Death occurs in 24 to 48 hours due to acute pulmonary edema. And the treatment again, the eye wash with boric acid. Then, depending on the condition, oxygen supplementation, even adrenaline injections may be required, antibiotics, and because the respiratory irritants may cause cough, some cough suppressants or some cough syrups. There is another common term probably we know about tear gases. What are the tear gases? These are mainly chloracetophenone, which is a solid, and ethyl iodoacetate, bromobenzyl cyanide, they are liquids. The other chemicals which are used are xylyl bromide, 2-chloroacetophenone and dihydroxyzine. These liquid agents, they become gases at the normal temperature and at normal pressure, and these things are normally used to disperse the crowd. Earlier use of tear gas was common to disperse the crowds in agitators, demonstrators and protesters. I think now the use of tear gas has come down. Now they are using this water cannons. They are putting the water because there was a lot of effects, ill effects or bad permanent effect on the persons when they are exposed to tear gases, because they cause a lot of irritation in the eyes. There was a very copious flow of tears. There was severe spasm of eyelids and even temporary blindness was the result of it. And the tear gases cause a lot of respiratory irritations, and this continuous exposure may even cause a lot of nausea or vomitings, blisters of the skin. So the patients were becoming very much restless, and so the individuals who are exposed for the tear gases must be removed to the fresh air, and the eye should be washed immediately with normal saline or even with the boric acid solution, and weak sodium bicarbonate solution is applied to the affected area on the skin, and depending on the respiratory symptoms, if there is a bronchospasm, wheezing, the inhalation may be necessary by salbutamol, or even injections with aminophylline may be required. The nasal irritants, they are solid organic compounds of arsenic, and they are used or they are fired in artillery shells. The vapors, they cause intense pain and irritation in the nose and sinuses. So they develop lots of sneezings, headache, there may be excessive salivation, nausea, vomiting, tightness in the chest. So these are also an agents which are used in the shells in wars. Similarly, there are paralysants and even the nerve gases. See, in the nerve gases, the major agents are Ga, that is stabun, Gb is sarin, Gd is soman, Ve, Vm and Vx, and the vapors are heavier than the air, so they tend to sink to the valleys and trenches in the basements and also in cellars, and they are absorbed from the lungs and gastrointestinal tract, skin and also from the conjunctiva, and these things they inhibit the acetylcholinesterases, and they are the most toxic of the known chemical agents. So the larger exposure, a large amount of exposure will cause loss of consciousness within seconds, followed by several attacks of convulsions. There may be larger amount of they may develop bronchospasm, hypotension, bradycardia and cardiac arrest. And patient may die because the muscles they become flaccid and the breathing stops, and the treatment will be similar to that of what we did when we were treating the patient with organophosphorus poisoning, because the mechanism of action is same here like that of organophosphorus poisoning. They inhibit acetylcholine esterase enzyme. You should also know one term, the chemical warfare, the offensive use of non-living toxic products produced by living organisms, like the toxins such as botulinum toxin or soxytoxin and chemical agents, they are considered as a chemical warfare. And these agents are used to injure or kill the enemies during the war, and they produce physiological changes on the human body, and some substances are lethal and some injure or they make a person incapacitated. And these substances, they are dispersed as a tiny droplets through chemical shells or even through spray tanks, bombs and even through missiles. So the harmful effects are caused when the chemicals are inhaled or when they are ingested, or even if they come in contact with the skin or the mucous membrane. So such chemicals are also used, which are known as chemical warfare. You also should know about biological warfare. The biological weapons, they are defined as microorganisms or their products of metabolism that infect and grow the target host, producing the clinical disease, which can kill the individual or it can incapacitate the humans or the animals. See, Bacillus anthracis, smallpox virus, botulinum toxin and resin are commonly used, and other agents like the bacteria which causes plague, cholera, typhus and even brucellosis, salmonella, Ebola virus, heparin toxin, they are also used in the biological warfare. See, now in this pandemic of COVID, many are suspecting even it could be like a biological war where the Chinese have intentionally released this manufactured or laboratory produced virus, the COVID virus, and which has resulted in such a pandemic which continues to harm the humanity, where millions and millions of the people have already succumbed to the virus, and many are incapacitated, and the spread, the presence, its spread, its virulence is still continuing in the society. We do not know whether it was really a biological war, whether it was intentionally spread, because there are many theories and many opinions expressed. I think we do not know, we are not the correct persons to say, but there is a lot of talk about this virus being synthesized by the China and deliberately exported to the many countries, which has resulted in such a bad pandemic. So with this, I think there are many other asphyxiants which you can just go through your textbook. I think most of your syllabus which is to be covered for your curriculum is, I think, almost finished. I do not know. We are left with certain practical classes which I think will be communicated to you by Dr. Srinivas. We will see. I think if everything goes on well, if you people come to the college, if there are physical classes, I think we will be definitely taking the practical classes where there will be a lot of revision of the topics which we discussed in toxicology, injuries, and many other things. So, wish you all the best. God bless you all. Thank you.